I decided to do my research on fibromyalgia. I found that lots of patients that I was seeing had a diagnosis of fibromyalgia, and I wanted to gain a more thorough understanding of fibromyalgia. Fibromyalgia is a chronic and debilitating pain syndrome that affects approximately 6.4% of Americans. It can present at any age in life, but classically presents in middle aged women and is more common and more frequent in African American women than Caucasian women. Fibromyalgia was described by physicians as early as the 16th century. It wasn't until 1972 when the American College of Rheumatology released the ACR fibromyalgia criteria that fibromyalgia was recognized as a modern diagnosis. This criteria includes generalized pain in 4 out of 5 body areas present for at least 6 months. These 5 body areas are the right upper, right lower, left upper, and left lower, and axial. It's important to note here that jaw, chest, and abdominal pain are not considered generalized pain for this purpose. Widespread pain index greater than or equal to 7. Symptom severity scale score greater than or equal to 5. The WPI and the SSS are questionnaires used by the ACR for diagnosing fibromyalgia. I'll show an example of those on the next slide. And the final criteria, fibromyalgia must remain a valid construct irrespective of other diagnoses. This is the 2016 fibromyalgia criteria. The yellow box is the criteria that we just discussed. The red arrow points to the WPI, or the widespread pain index score, and the blue arrow points to the SSS, or the symptom severity scale score. You can press pause on this slide and take a look through the specifics of these criteria. Diagnosing fibromyalgia is mostly based upon the patient's history and the physical exam. We'll discuss this more on the next slide. While widespread pain is the classic symptom of fibromyalgia, patients can have a constellation of symptoms, including widespread pain, stiffness, fatigue, sleep disturbance, migraines, depression, restless leg syndrome, bladder spasms and pain, irritable bowel syndrome or IBS, paresthesia, weight fluctuations, and sexual dysfunction. On physical exam, you might see signs of deconditioning, multiple tender points, or signs of irritable bowel syndrome. It's important to note here that multiple tender points using the manual tender point survey is no longer a part of the ACR guidelines as of 2016, but physicians may still choose to use it to support their diagnosis of fibromyalgia. Another interesting fact here is that about a third of patients are able to pinpoint an event such as stress, illness, or injury that incited the onset of their fibromyalgia symptoms. Fibromyalgia is difficult to diagnose because there are no labs or imaging studies to diagnose it. Labs are useful, however, to rule in or out other differential diagnoses. I've listed some labs you may consider ordering here. Some diagnoses to consider on your differential are lupus, hypothyroidism, rheumatoid arthritis, and other autoimmune conditions, osteoarthritis, and electrolyte imbalances. Imaging is most useful to exclude osteoarthritis or rheumatoid arthritis, as well as acute or chronic musculoskeletal injuries. You may also need to consider referrals to occupational therapy, chiropractic medicine, physical therapy, physical medicine and rehabilitation, pain management, psychiatry, or rheumatology. These referrals will be made based upon the patient's individualized needs. Treatment of fibromyalgia falls under 2 categories, pharmacologic and non-pharmacologic. First, I'll discuss the pharmacologic treatment options. 3 drugs have been FDA approved to treat fibromyalgia. These are duloxetine or Cymbalta, milnacipran or Savella, and pregabalin or Lyrica. These are also useful at treating patients with comorbid depression. Some drugs that have been proven to be effective at treating fibromyalgia but have not yet been FDA approved are tricyclic antidepressants and tramadol. Some treatments that are proven to not have benefit in treating fibromyalgia are opioids, benzodiazepines, and SSRIs. It's important to note here that with increasing opioid use, the risk of an extensive constellation of adverse effects are increased. Pregabalin is the treatment of choice for fibromyalgia patients who have been previously treated with opioids. Many clinicians are well aware of the pharmacologic treatment options for fibromyalgia patients, but some clinicians may be less familiar with the non-pharmacologic options available for patients. Non-pharmacologic treatment options have actually been proven to be as effective as pharmacologic treatment options when compared with effectivity and cost effectiveness. Non-pharmacologic treatment options include cognitive behavioral therapy, aerobic exercise, and many others, including acupuncture, physical therapy, occupational therapy, yoga, tai chi, walking, and biofeedback. It's interesting to note that aerobic exercise was actually proven to be the most beneficial of the alternative therapies. Patients are encouraged to participate in an individualized exercise program that begins at a low intensity and gradually builds to a moderate intensity. As with any health condition, it's important to listen to the history given to you by the patient, as well as focus on their physical exam. This will help you to come up with an individualized plan to manage this patient's condition. Thank you for watching.